Hello, good. um, My name is Michelle Cunningham, Marketing and Outreach at Healthcare Workforce Development. We are excited that you have joined us today. Before we begin, I would like to discuss a few housekeeping items. The webinar is being recorded. The chat option is open. We will entertain those questions in the chat during the question and answer session, which is at the end of this webinar. In addition, your mic during the question and answer session, your mics will be enabled and you'll be able to raise your hand to ask questions. Let's go ahead and begin. And I am thrilled to introduce Jonathan Nazario, Program Officer with the Healthcare Workforce Development. Thank you, Jonathan.
Hi, everyone, and thank you for joining us today for the PCR webinar. Today, we'll go over the updates made to the PCR application. My name is Jonathan, and I am one of the program officers for the primary care residency programs. The technical assistance guide will be posted to the Song Brown webpage for your reference. It may be helpful to have this technical assistance guide open while working on your application. Song Brown provides funding to education programs such as primary care, family nurse practitioners, registered nurses, midwife programs such as certified nurse, midwives, and licensed midwives. Song financial incentives to programs to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate the program's main training site in a medically underserved area, operate a main training site at which the majority of the patients are medically. As you all know, the application opened on June 30th and the deadline is August 12th at 3 p.m. If you submit your application prior to July 29, 2022, early submission review date, you'll be eligible for a pre-application review. In this process, a program officer will review your application and provide feedback. Once feedback is received, you will have 5 days to correct any errors on your application. If you submit after July 29, 2022, you will not be eligible for such a review. Only applicants that submit their application by the early submission date will have their applications reviewed and be allowed to make corrections. Please keep these items in mind and share our grant agreement with your contracts officer if needed. HCAIA won't make any changes to our grant agreement language. We have a brand new funding program. If you know someone who is wanting to start a training program, please share this information with them. We need more programs to apply. Changes for 2022 include 2 new program funding opportunities, new programs for up to $1 million, new programs with a funding match up to $2 million. New programs application includes application questions and changes to the scoring criteria. Here is information to gather prior to completing your application. For existing expansion and THC, those items include grant agreement and pay data record information, facility type for each primary care continuity clinic training site, payer mix information for each listed primary continuity clinic, race and ethnicity data for all current residents, high school information such as name and address for all current residents, correct organization name. Incorrect information can delay the agreement process. Current practice site information for all graduates entered, national provider identification number for all graduates entered, applicable required attachments for ACGME accreditation or ACGME expansion letter, current permission from your organization to apply for a grant. Here's some information to gather for your new program. It's a grant agreement and pay data record signatories, facility type for each primary continuity clinic training site, payer mix information for each listed primary continuity clinic, correct organization name. Incorrect information can delay the agreement process. If applying for new programs application, you may be required to provide documentation for each corresponding phase that you have completed. This slide shows the available Song Brown funding categories. Please keep in mind that if you are a new program, you can only apply for new programs funding. New program funding categories have changed. This table shows the award categories, overall dollars available for each category, award amounts, and a disbursement method should you receive an award. This page contains helpful information for your reference, including the Song-Brown glossary and grant guide. At this point in the presentation, we are going to skip a tad ahead as mostly everyone has our NEApp account already. However, if any changes have been made with your program directors, training programs, organizations, please send us an email immediately. That said, we will now skip ahead to start an application. We will now go through the initial parts of an application. Select your training program here, or if not found, click on the training program not listed. Use the magnifying glass to locate your training program name. If your training program name isn't in the system, add in the training program name and address. You'll be your training program address at the top of the page. Your training program address may be the same as your organization address if you're holding your program at that facility. If the program will be held at another location, we would like you to input that address for where the training program will actually take place. If Google can't find your address, please let us know through email. Program information will also list the award categories to which you can apply. Now I want to give you a brief overview of the new programs. There have been many changes to the new programs, which includes new programs match. Please note that when starting this application, Phase A is mandatory to receive either type of new programs funding. The phase that you have completed determines which new program application you are eligible for. To determine your eligibility for new programs match, you will need to ask yourself the following questions. In the process of applying for or has already received sponsoring institution accreditation, have you not received any prior Song-Brown funding? Are you in the process of completing or have completed phases A through C? You have not completed phases D through G. You are willing to match 25% of your organization's funds toward TAKAYA's total award. If yes to A to C, you may be eligible for new programs with the match. How new programs with match works. If awarded $2 million, you will need to match 25% of the awarded funding using your own funds outside of the grant funds that were awarded. Your total budget being $2.5 million. To determine your eligibility for new programs, you will need to ask yourself the following questions. Have you received sponsor institution accreditation or will have applied for sponsor institution accreditation by time of annual PCR application release? Have you obtained residency program accreditation? Has no first-year residence at the time of the application? Has not received any Song-Brown funding? Has completed phases A through D? If yes to A through D, you may be eligible for new programs funding. Now we're going to start the new program application process. To start the new programs application process, check that box, New Program. After completing this page, click Save and Next. The contract administration page comes next in the application. Two very important notes. Your 204 address is your remit to address. If you're at all uncertain what address your payment should be sent to, please consult with your contracting authority at your organization. Additionally, your contract organization name must match what is reported to the IRS. Incorrect information on this page may cause delays in your grant agreements or your payments. New sections have been added to this section. PO Box option for the 204 is a new category. Read these phases carefully. Select the response that best describes the status of each phase listed. Please select your yes responses in the order you see them. There should never be a no before a yes. Selecting yes to D through G makes you eligible for up to $1 million in funding new programs. Supporting documentation is needed for each phase, except for training sites recruited. Please note, we don't want all training sites, just your continuity training sites. When selecting an address, please include the address of the continuity training site. Please select the facility type that applies to this continuity training site. If your continuity training site doesn't fall under any of these facility types, please select not applicable. An example of facility type that does not fall into one of these selections is a general acute hospital. Enter the payer mix information of each continuity training site you enter. Everyone will likely only have one or two. Please enter in your payer mix as a whole. After entering the continuity training site information, you can edit or delete that information by using the Options button on the right side of the page. The executive summary and program strategies consist of one question and a series of strategies to select. The executive summary is required to be answered before continuing to the next page. How you answer these questions, these strategy questions, can affect your scoring. The residency training section consists of a series of questions. After completing this page, click Save and Next to proceed. You will have to enter in how much funding you are requesting here. Max funding request for new programs is $1 million. Max funding request for new programs with a match is $2 million. Please remember, you have to do a 25% fund match with new programs with a match. New programs match will populate an additional table, budget/funding. Provide your anticipated or actual expenses related to each budget category listed. Separate your costs into their respective phases. You must put in a $0 amount into remaining used fields. The comment box is only utilized when you have identified an expense that falls into other. Please provide the patient demographics here. Please note, total percentage of each section cannot surpass 100%. Files uploaded must include a prefix. Save your document using a prefix indicated prior to uploading. The red buttons on this page indicate required documents based on your phases responses. Please remember the required documents correspond with the phases you selected in the program data page. Once you upload all required documents, the buttons will turn green, signifying that you may continue. Please take into consideration that upload speeds may take longer than other experiences. Assurances page needs to be checked before submitting your application, and click Agree to submit your application. New programs application has been submitted. To view or print your application, click on the down arrow button. You have the ability to print the application, but in sections. The graduate program information will be on a separate print option. Next, we will discuss how to complete an existing teaching health center or expansion application. A lot of aspects in this application process have not changed since last year. Today, we'll focus more on what has changed. Each funding category listed provides eligibility criteria. Click each funding category you qualify for. Select your training program here, or if not found, click on the training program. Use the magnifying glass to locate your training program name. Existing expansion and TC applicants most likely have applied in the past and should have a training program name already. The next few slides are similar to the new program contract administration page. We will briefly go over them again in case you missed hearing that information. Ensure all information is accurate and that the correct signatories are listed. Please verify this information with your finance or contracts officer to ensure this information is correct. Providing incorrect information will delay your grant agreement should you be awarded. Provide program data on graduates and residents. Depending on your selection, additional questions may appear. For example, click on residents and graduate data, and you will have to provide information for both. If you don't have graduates yet, you'll click resident data only. You have the option to import your previous application data into your new application. You will need to continue to use your previous program training name to utilize this feature. Magnifying glass to search for your training program name. If you have to type in your name, this will not work. This import feature may not work for you if you did not apply last year. All your resident, graduate, and continuing training site information will transfer over. Second and third year resident data should import over from previous applications. You will still have to enter in your first year residents. If importing training sites this year, only your previously identified continuity clinics will come over. Then you'll need to add any other continuity clinics. Imported data transfers to the errors list, then you'll be required to check each individual record to clear it and move forward. Please note, most programs only show 1 to 2 primary care continuity sites. Unlike before, we are not looking for all training sites. Select the facility type that best applies to the continuity training site. If your continuity training site doesn't fall under any of these facility types, please mark not applicable. Provide the payer mix information for each continuity training site you enter. Again, you're only providing your continuity clinics. Payer mix information is required for your main primary care continuity clinic. Keep in mind that the payer mix information doesn't need to total 100%. On the training site reviewed, you must say yes to move forward. After entering in the continuity training site information, you can edit or delete information by using the options button on the right side of the page. This application has an executive summary along with a program description. You will enter in your executive summary and program description into these 2 pages. Where you choose, be prepared to provide additional information. Your annual expenses can be higher than what you're requesting. However, they can't be lower. Please fill out all of these fields. Applying for THC funding, you need to fill out a budget summary. If you aren't requesting funding for a budget category listed, input 0. If importing resident data, please ensure that all resident data has successfully transferred over. View previous resident data in the eApp under the Applications tab. Imported data transfers to the errors list, then you'll be required to check each individual record to clear it and move forward. Add an additional resident here if needed. Once you click Add a Resident, a window will populate. Fill out all the required fields. After completing this page, click the Submit button. Once completed, you can add more residents. In addition, you can edit or delete information that you inputted. If you're importing graduate data, please ensure that all graduate data has successfully transferred over. You can view previous year's under the Applications tab. Imported data transfers to the errors list. Then you'll be required to check each individual record to clear it and move forward. Here you'll add additional graduates if needed. Once you click Add a Graduate, a window will pop up. In addition, keep in mind that the amount of graduates input needs to match the amount of graduates on the program data page. Graduate practice site data should always be the most current practice site data. Selecting yes to the question, do you know the graduate's practice site, will prompt further questions. A facility type list will populate. Select the facility type that applies to this practice site. If the practice site doesn't fall under any of these types, please mark not applicable. Click that Add a Graduate button for each time you want to add a graduate. You can also edit and delete the graduate information from this page. Here are some common application mistakes. Please review these carefully. One of the major things we've been seeing this cycle is applicants have added a training program name and did not search for a previously used training program name. You can attach documents pertaining to accreditation approval and, if applicable, expansion approval here. Once you upload all required documents, the buttons will turn green, signifying that you may continue. Click Save and Next to continue. The services page needs to be checked before submitting your application. Once you click submit your application, it will be completed. To view the information submitted or print out the information, click on the down arrow button. Application button in sections. The graduate/resident and training program information will be on a separate print option. Please remember, if you know someone who is wanting to start a training program, please share this information with them about the new program's funding opportunities. Thank you. This is the end of our presentation. Now we will give you the opportunity to ask your questions. Please use the chat function to raise your hand for any questions. Any questions?
Hi, thank you, Jonathan, so much. So a reminder, option is open. Please feel free to place your questions in the chat. In addition, you may raise the hand icon, which you'll find at the top of your screen with the reaction button. Once you raise the hand icon, you'll be placed in a queue. I'll call on you. Your mic will be enabled. You will need to unmute yourself. To unmute yourself, the mic button's at the top of the screen. Please mute yourselves after speaking. And let's go ahead and start. Thank you. Debbie Lipica, apologies if mispronouncing your name. Thank you.
Oh, that's okay. Hi, yes, Dr. Lipica. So this is always a question every year for the resident data. Do we add our residents we just match with the ones who started July 2022? Or is it just the residents who were on last year? So basically, do we add our new interns?
I can take that question if it's okay with Jonathan and Clinton.
Yes.
Hi, this is Melissa, the Song Brown Program Manager. Yes, you would add in the residents that just started July 1st, 2022. And that's because of the timing of this application. It shifted information, it shifted the resident timing. So we are asking that you put in the 22, the residents that started 7/1/22.
Okay, thank you, Melissa.
You're welcome.
And we have a question in the chat. Pam asked, is resident high school a scored application element?
Currently it's not, but it will be in the future. Right now we're collecting that information so that we can create proper scoring criteria.
Thank you, Melissa. Carolina has her hand raised, please. Unmute yourself.
Hello, hi. First time applier for the program that I'm currently in. I did do this about 5-6 years ago. So I'm a little rusty. Plus I'm a new program, which is a whole other status. Due to the community that I'm in, I'm not too sure if they're gonna know what I mean by payer mix, as far as when I reach out to the clinics. Is there a recommendation as to how to describe what a payer mix is to like their clinic manager?
I think that we have a definition in our glossary of terms. Our glossary of terms is on our website.
Okay.
So I would try that. I think there's a definition in there.
Okay, great. Thank you so much.
You're welcome.
Asks, when you log in, does the application require it to be submitted all at once? Or can you save your progress as you answer questions?
I can answer this one, Melissa, if you're okay with that.
Go ahead.
So you start your application and come back later. However, if you want to save the data on that current page, you have to click Save and Next, go to the next page. If you don't do that, you just log off. It probably won't save that data. So make sure you click Save and Next, and then you can go ahead and log off and start back again later.
Thank you. And Dr. Lipica, do you have another question?
No, sorry, I'll put my hand down.
Okay, thank you. In the chat, Eva asks, what are the expenditures we can include for the grant funding?
I think it's included in there, right? It depends on what type of grant funding are you going for? Are you an existing or a THC? That would be a THC, and this new programs with a match are the only ones that have a budget, if I remember correctly.
Eva, does that answer your question fully? If you want to unmute yourself and follow up with that, that's fine. Okay. Another question in the chat from Celia. Is there an IT support number that we can reach out to? We have been having issues moving beyond the training site page.
I can answer that one too, most if you're okay with that.
Yeah.
Your program officers are going to be your basic IT people. They can either troubleshoot the issue for you, or if we can't, we will escalate the issue. The best way to get a hold of us is through email. Please send us an email through the Song Brown email box. The email is on the screen too if you need it.
Lisa has a question. Can we pull resident data from the last cycle to the graduate list for this cycle? Or do we have to re-enter the data?
I can answer that too, Melissa, if you're okay with that.
Okay.
Okay. So depending on what resident year was last year, if you to import the data this year, make sure you use the correct training program name, by the way, by searching for it. It should import them automatically as graduates. So if this function isn't working, let us know through email. But yes, the resident data can pull over into graduate data, but that it depends on the resident year. So if they were third-year residents, they would be graduates this year.
You asks, I have a question regarding the funding categories. Our program is already accredited, and we are hoping to have more residents targeted for primary care track, especially for our current community medicine fellowship. However, I'm wondering if we should be applying for existing slot or expansion slot. We technically can support either category, but not sure which one to select for the application.
I can answer this. So in order to apply for expansion funding, you have to have approval by the ACGME to actually expand your program. So if you don't have that from the ACGME, then you would be looking at existing program funding.
All right, and feel free to raise your hand. I'll call on you as well. Here we go with more questions in the chat from Pam. I will be submitting data populated, but it was under the resident data page. I had to delete the graduates in order to complete the current resident data page. But now nothing is showing for my graduate data page. Please help. That is from Anna Hall.
I can answer this one if you're okay with it, Melissa.
Go ahead.
So we are aware of the issue. Please stand by. Send us an email about if you're having this issue. We are working with our IT department to try to fix it. Once it's fixed, hopefully everything will go back to how it should be presented. Thank you for the question.
And Christy also mentioned that the grad data issue has happened for their program too. And Pam mentioned the same thing happened on their application.
Yeah, again, sorry about that. Again, send us an email so we can ensure that all your data is transferred properly after it gets fixed. Again, this is random, and sorry about that issue happening to you guys.
Thank
We're
you.
we're working on it, folks. So if you could reach out to us through email, send us an email, let us know, and we'll look into each and every email until we get it fixed for you all.
Thank you. From 80, my program applied last year and the option to transfer the resident data was selected, but the information is not transferring, excuse me. Any recommendations on how to fix this?
I can answer this one too, Melissa, if you're okay with that.
Go ahead.
So I would go back to where you had to enter in your training program name. If you had to enter in your training program name, most likely it wouldn't be working. You're going to need to search for your training program name. And then once you do that, the import feature should work. If it doesn't, please let us know. Also, please keep in mind you would have to have applied last year. If you didn't apply last year, the import feature will not work. Again, try that option. And if it doesn't work, send us an email, please. Thank you.
If you're not sure of what training program name you used last year, please reach out to us and we can let you know for sure, so that you get, so that you're using the proper training program name in that field.
From Claire. Hi there. For the fiscal plan attachment, do you have examples so we can format our plan correctly? What information should we include?
Okay, well, we are assuming that you are working with the ACGME on that part of the accreditation, and so whoever you're working with to provide this fiscal plan should have given you pointers on how to fill that out, and that's what you would submit back to us. We can't tell you how to create a fiscal plan. I know that some folks hire consultants that help them with that whole process. We can't provide you with that information.
All right, thank you, Melissa. And Anna reemphasized the point about the graduate data page, which I know Melissa and Jonathan covered.
Right.
Any other questions in the chat or raising your hand? We have plenty of time. On a side note, this webinar recording will be posted on our website. All right, thank you. Pam, if you can unmute yourself, please.
Good morning. This is Pam Choice from Family Health Centers of San Diego. I actually put something in the chat that was skipped. I wanted to let you know that I'll be submitting our completed application in just a few minutes after we get done with the call. And I know that you offer a review and open it back up in case there are errors that need to be corrected. I know there's time to submit the application. I'm personally on a tight deadline because I have vacation coming up. I'm just wondering if you can give me an estimate of when I might hear back from you so I can take care of any corrections.
If you submit it today, if you are able to submit your application today, within 48 hours, we'll take a look at the application and get back to you with any issues that we see.
Fantastic. Thank you.
Thank you, Pam, and my apologies for missing your chat question. Next question,
No problem.
Lasha. Thank you. Lasha Pierce, please unmute yourself.
Hi, it's Laisha. Thank you. We have a question. We expanded our program and the current returns expansion. So would we apply as an expansion or just as an existing program?
Existing.
Okay.
Thank you.
Thank you.
Thank you, Lasha. Next question from Lise in the chat. Just to confirm, the funding for existing slots is for residents starting AY 23-24, correct?
Correct.
Thank you. I don't know if you have another question, Lasha. Your hand's still raised, but go ahead.
No, it's I'm gonna unraise it, but it's Laisha.
Okay. Laisha, excuse me.
Yeah.
Lauren, if you can please unmute yourself.
Thank you. I have a quick question. We have a program in initial accreditation with the ACGME. This year is our second year of residence in the training program. I just wanted, that's considered existing, not expansion, correct?
Okay, how, can you explain to me how you have residents, but can you explain to me about your accreditation? Sorry.
Sure, we received initial accreditation from the ACGME in 2020. So we
Yes.
have, our second year just started. So we have 2 years. We don't have a full 3-year class, a full 3-year class yet.
Right. So yes, you are existing. You are considered an existing program.
Thank you.
You're welcome.
Thank you. Any other questions? Please let me know if I missed anything in the chat or if you have any, oh, Jonathan Ballard, please.
Hi, yes, my name is Jonathan, and I am with an existing program. And looking at the residency program, breaking down like the faculty costs, residency stipends, family practice center costs, are there specifics on how to get those specific numbers as far as to make sure we're getting the right final estimates?
No. I think that's that's a conversation between you and your finance office or whatever. We're just looking for, you're not scored on this. This is just information that we have to collect based on the statute, because the statute says any existing program, you cannot go backwards in your, you can't. The first year that you had, that you received Song Brown funding, if you said that your expenditures for the year were $1 million, you can't come back to us the next year and say it's less than $1 million. So we're just looking to make sure that your expenditures from year to year are not less than the first year that you ever applied to Song Brown.
Gotcha. Thank you so much.
You're welcome.
Checking for any more questions, please, or comments. Thank you. Well, I don't see any more, team. So, Jonathan, you want to wrap it up? If we don't have any more questions?
Thank you everybody for joining today. We greatly appreciate it. If you have any questions, please send us an email through the Song Brown email box and we will get back to you as soon as possible. Thank you again and have a nice day, everybody.
Melissa or Jonathan, I put a question in the chat. Can you hear me?
Yes.
Yes.
In high school, if the person is homeschooled, the home address at the time that they were in high school, right? Not like their current home address.
Correct.
Okay, just wanted to clarify that. Thank you.
You're welcome.
Thanks for the all the answers to the questions on the webinar. It's very helpful.
Thank you.